Okay, good morning, everybody. Lovely to have you all here today, and welcome to the SEND Communities Practice session that is, I'm happy to say, is being hosted and facilitated by our partners at Early Intervention Foundation. So really looking forward to joining and facilitating one of the breakout rooms today, and I hope you get everything you want out of the session over the next hour. So without further ado, I'll hand over to Bethan to introduce themselves at Early Intervention and enjoy the session.
That's brilliant. Thank you very much, Steph, and thank you for inviting us along to support the session today. And just to say a huge thank you to everyone for joining as well. So I'm going to take a few minutes just to summarise what we're hoping to cover today. Before I do that, just some very quick housekeeping to quickly say that we are recording the session, and we will share both the recording of the session afterwards and also the slides. So there are some links in the slides which we'll make sure you have access to when we send a follow-up. Just to say as well that the Q&A should be open during the session. We've dedicated quite a lot of the session today to the breakout room discussions, so we may not have a chance to get to that during the session, but please do pop your questions in and we will make sure to respond to that as part of the follow-up from the session this morning. So hopefully you're familiar in some way with the RPC practical guides, which so far have focused on supporting healthy relationships among separating and separated parents and supporting healthy relationships among minority ethnic parents. And the most recent guide, which was published in July, I think, could I just check everyone's on mute? I'm getting a tiny bit of feedback, just for everyone to double check. I'll carry on. But so the most recent guide, which was published in July, focuses on supporting healthy relationships among parents of children with behaviours that challenge. And that's what we're going to focus on today. And in just a moment, I will briefly introduce the rationale and the structure for the guide. And then I'm going to be handing over to Virginia, who will take us through an overview of the research, before we then separate into the breakout rooms, where we will talk about one of these two areas. So how evidence can be put into practice to inform your local strategy, or engaging parents of children with behaviours that challenge. And hopefully you will recall that when you signed up for the community of practice, you've selected a preference for a breakout room, and we've allocated the rooms in that way. So before I introduce the rationale and the structure of the guide, I just wanted to make a point on the language. So the focus of the guide is children with neurodevelopmental difficulties or diagnosed neurodevelopmental conditions who may manifest behaviours that challenge. And we use the expression behaviours that challenge to refer to persistent behaviours that children can demonstrate in a number of different ways and in various settings, from becoming withdrawn, which we might talk about as internalising behaviours, to acting aggressively or externalising behaviours. And we know that sometimes these are described as challenging behaviours, and we recognise that those behaviours, which are often caused by distress and are unintentional, can be manifested in children with and without neurodevelopmental difficulties and disabilities. But we also know that children with neurodevelopmental difficulties and conditions might face additional barriers in having their individual needs met when compared with other children, and that might then result in more frequent distress and consequently more frequent manifesting of behaviours that challenge. So why this guide? We know that currently there's relatively little attention paid to how parental conflict affects the lives of children with special educational needs and disabilities in the UK. So we've developed the resource to improve the understanding of how risk factors among parents of children with behaviours that challenge can impact on parental conflict and in turn on child outcomes, and to support local areas to effectively engage those parents and to consider their evidence-based support and what can be offered, and then how to appropriately assess progress for those families. And as I've mentioned previously, the guide focuses on children with neurodevelopmental difficulties or diagnosed conditions who manifest behaviours that challenge. And research suggests that parents of children with behaviours that challenge might experience higher levels of parental stress. And this is associated with a higher risk of relationship distress and conflict, which in turn can then affect outcomes for children. And it's important to note, I think, that the scale and impact is likely to vary for children with different conditions and with different levels of support. So in terms of what the guide includes, the guide's developed for local leads and commissioners and practitioners to really support in improving understanding of the factors that increase the risk of parental conflict among parents of children with behaviours that challenge, and also to help in terms of engaging parents, thinking about what can be offered and assessing progress for those families. We'll discuss in a bit more detail in the breakout rooms, but I think it's important to note that the guide isn't designed to be prescriptive, so it won't recommend one particular intervention, measurement tool or engagement strategy. So it's intended to provide practical advice to local authorities who have an interest in improving their understanding, their local offer, and also evaluation in this area. So it includes an overview of the research, advice on how the evidence can be put into practice to inform your local strategy, and we'll discuss that further in breakout room 1 later on, and also recommendations on how to engage parents from this group, which we'll discuss further in breakout room 2. It also includes a summary of evidence-based healthy relationship and parenting interventions, which might be helpful as part of local support pathways for parents of children with behaviours that challenge, and also a summary of measurement tools that can be used to measure parental conflict and parental stress amongst this group. So I'm going to hand over to Virginia now, who's going to take us through an overview of the research.
Thank you, Bethan. My name is Virginia Ghiara. I'm head of What Works for Parental Relationships at EIF, and I've been working on the guide Bethan just presented. So with this part of the presentation, we will just focus on the research evidence we identified working on the guide, and also the evidence we collected working in consultation with local experts, so practitioners and local leads working with families with children with behaviors that challenge. If you can go to the next slide, please. The first slide I'm going to present is just a summary of the takeaway messages we can identify looking at the research evidence in the guide. The first important message is that it is unclear from the research evidence if parental conflict happens more often among parents of children with behaviors that challenge. And this is because we still have a lack of evidence and a lack of data, especially if we consider the UK. So we still don't know how parental conflict is prevalent among this group of parents. However, if we look at the evidence we have, most of the research studies and most of the UK evidence is focused on autistic children and their families. And what we can see is that autistic children, as well as their siblings, are more frequently exposed to parental conflict, and they are more likely to be discussed as a topic during such conflict. We know that this is a very important aspect, because if you consider how parental conflict can impact children, one of the key mechanisms is through exposure. So if you're exposed to parental conflict, this is likely to impact actually your outcomes. So your impact your well-being and different factors of your life. At the same time, we know that another important aspect is how the child can process parental conflict. And of course, being the topic of such conflict can be very challenging for children. So we know that these are two aspects that can be taken into account when reflecting on the impact of parental conflict on children with behaviors that challenge, and in particular, autistic children and their siblings. When thinking about parental conflict with these parents, we know that there are multiple factors that can influence experience of parental conflict. including poor role balance and also parenting disagreements. And we know that parenting, based on the evidence we collated, is an important aspect to consider for parents of children with behaviors that challenge. It can be very difficult to find a good balance between the parents, and something that we also discussed with practitioners and local leads when working on the guide was that several times you have parents just looking after the two different children in the families and not having enough time actually to work on the relationship and solve conflict if there is any conflict. If we can go to the next slide, please. In the guide, we tried to understand what kind of factors can impact parental conflict and what we know about the prevalence of these factors among these parents. The first important factor is, of course, mental health. We know that parents with children with behaviors that challenge might experience mental health difficulties, and in particular, anxiety and depression. And we know that mental health, of course, can have an impact on parental conflict. And at the same time, parental conflict can also influence mental health. So this is an important aspect that you might want to consider when supporting these parents. Access to service is also very important. And we know that if parents experience challenges in how they access services, they might also have difficulties in the relationship. There is some evidence suggesting that there is an association between these challenges and challenges in the parental relationship. Support networks can be very important to make sure that parents can have a positive experience and know how to deal with challenging situations when parenting children behaviors that challenge. And looking at the evidence from the UK and international evidence, we identify that support network can have an impact on mental health and parental stress. So if you have a strong support network, then it's likely to have a positive impact on your mental health, and also it can decrease your level of parental stress. If you have a poor support network, or if you have challenges with your support network, this is likely to have an impact, a negative impact on your mental health and parental stress. And this in turn can also have a negative impact on the quality of your relationship. Financial pressure can be a very important aspect. We know that some parents of children with behaviors that challenge might have difficulties in terms of financial pressure because of caregiving responsibilities or additional costs they have to consider in the family, and this can also lead to conflict in the family. And finally, we have some evidence from the UK showing that the diagnostic process and heavy challenges during the diagnostic process can have an impact on relationship satisfaction, so how parents are satisfied in the relationship. So this is just a very brief overview of the different factors that might impact parental conflict with this group of families. If we go to the next slide, we have an important slide on parental stress. So far we mentioned that parental stress can be actually something to consider when you reflect on parental conflict among this group of parents. Looking at the evidence, we have some studies showing that there is an association between behaviors that challenge and parental stress. We know that there are particular behaviors that might have a strong association with a high level of stress, such as children not answering when people are speaking to them, having problems speaking, and experiencing meltdowns or shutdowns. This is not a comprehensive list, but it's just to show how different behaviors might actually have an impact on parental stress on the daily basis. But at the same time, we know that there is a dynamic association between parental stress and children's behavior. So on the one hand, behaviors that challenge might have an impact on parental stress. On the other hand, parental stress can have an impact on children's behaviors. And this is particularly true if you consider middle and late adolescence. According to the evidence we identified, this is the time where a high level of stress among parents can have the strongest negative impact on children's behaviors. Of course, again, this depends on the evidence we have, which is at the moment very limited. So we cannot actually say that this is the only moment where parental stress can have an impact on children's behaviors. Finally, when compared with other parents, parents of children with behaviors that challenge have a higher level of stress across time. If I can ask people to check if they are on mute, that would be helpful. Thank you. So if you consider other families, and if you consider the level of stress, in general, new parents experience a high level of stress during the first years, but then the level of stress tends to decrease over time. This is not the case for families with children with behaviors that challenge. The level of stress can remain constant or can even increase. And this is not only due to the fact that there are, of course, behaviors that challenge that might impact parental stress. Sometimes it's just life events that can be particularly challenging for some families. And just to give an example, we know that school entry, based on the evidence we have, can be a very challenging moment that can have an impact on parental stress. And this is actually regardless of behaviors that challenge experienced at that moment by the family. If we can move to the next slide. So far we explored what kind of impact parental conflict can have on children and what factors can have an influence on parental conflict. Of course, one of the key questions we want to ask ourselves is how we can support these parents. And the first step will be to make sure that we can engage parents and we can approach them in the right way. Looking at what evidence we have in this particular area, we know that there are particular barriers that might have an impact if you consider parents of children with behaviors that challenge. The first one is awareness barriers, the group of awareness barriers, which include not recognizing the need for support. Now, of course, we didn't have the time to include everything in this presentation, but in the guide, you will find very strong quotes and very strong reflections from practitioners and local leads working with families. One of the key considerations was that most of the time, parents are just focusing on the needs of their children. They want to meet those needs. They don't have the headspace and the time to think about a relationship. They don't have the time to reflect on how they can get support to improve their relationship. So this is, of course, one of the challenges practitioners might experience when approaching parents and discussing parental relationships. A second group of barriers is accessibility barriers, which include cost and location of interventions, as well as timing, not only at what time the intervention is delivered, but also at what point in the intervention is offered within the relationship conflict. Another group is acceptability barriers, which include feelings of personal failure associated with seeking help. And finally, specific barriers for accessing relationship support, such as the perception that interventions can be unsuitable or detrimental to people's needs, or the notion that relationships are private and should be managed only by the couple. If we move to the next slide, I think the next slide is very interesting and important. We try to understand how we can actually meet the needs of the families, what kind of strategies can be used to engage families, take into account the barriers we just discussed. And this part of the guide is done in consultation with practitioners and local leads. So we were thinking about the best strategies used at the moment that are effective in engaging parents. So the first, this is just an overview and you can find much more in the guide, but the first point is about giving parents information about the support they will receive and how the process will work. This means giving information about the length of the intervention or the support, the length of a particular session if you're inviting parents to a session, who needs to attend the session. And in some situations, you might have parents sharing actually the needs of their children. And in that case, it might be helpful also to provide, for instance, a photo of the room where the intervention will be delivered, as well as some information about how the intervention will be delivered, who will be in that room, and so on. Acknowledging differences and offering choices was presented as a key element. So, of course, for this guide, we had to consider all families with children with behaviors that challenge together, but actually there are differences and all families are different. This means that something that might work with a family is not very effective or is not meeting the needs of another family. And making sure that you can acknowledge these differences, you can think about the unique situation of the family, as well as offering different options to support the family, can be very important to make sure that they can understand why a particular intervention can support them, and they can ensure that actually what is offered can meet their needs. Promoting peer support and good partnership working was actually discussed a lot during our consultation with local areas. Promoting peer support means that you can allow parents to get some support from other families experiencing similar situations. Sometimes a family is so overwhelmed that they are just considering receiving support and working on the relationship too much for them. And making sure that they can have some support from other families experiencing similar situations, similar challenges, can be very important. And of course, working with the voluntary sector and partnership working can be an important aspect to consider, because there may be already relationships between particular organizations, for instance, and a family. Involving fathers is always considered quite challenging, and in case of fathers of children with behaviors that challenge, this can be quite difficult. Fathers may need to approach support in a different way. They may need a bit more time to understand why they need support or how the support can meet their needs. But at the same time, there were very useful considerations about, for instance, fathers being very interested in evidence and information on how parental conflict can impact the children. And this was considered quite important because evidence is not blameful. So it can be a good way to approach fathers and to start a conversation about parental relationship. Providing different modes of services delivery to accommodate diverse needs was, of course, key. So some families might prefer group support, others might prefer individual support. Some families might prefer to receive support online, while other families might prefer to be face-to-face. And finally, always consider how the pathway to support can be improved. So always consider how you can receive feedback, how you can take into account feedback received from families, and how families are accessing support is a key element to make sure that you can have a very strong support pathway for this group of families. So this was a very quick overview. I hope it was helpful. There will be more time to discuss some of these points in the breakout rooms. And of course, you have much more information in the guide. I think this is my last slide, so I will hand over to Bethan again.
Thank you, Virginia. That was really, really helpful introduction to the research and evidence. So thank you, as always. So we are now going to split out into the breakout rooms as discussed. So hopefully you will remember that when you registered for the webinar, you selected one of the two breakout rooms. So the first being how can evidence be put into practice to inform local strategy, and the second engaging parents of children with behaviours that challenge. So we will now break off into those rooms. We'll have 20 minutes in the breakout rooms, and we will come back together at roughly 10:45 so that we can hear from the other rooms and we can kind of hear that feedback together. So there will be a facilitator in each breakout room who will support the discussions, but we are of course really interested in hearing your views and thoughts and what's kind of working well locally in this area, and that would be the theme for kind of our feedback. So hopefully we are all set with the breakout rooms, and Robin, we can get those kicked off if possible.
Yep, I'll open them now. It might take a few seconds for everyone to join.
Brill, thank you. I was cut off mid-flow. I didn't do very well with my time.
You always know that it's about to end, but still start a new conversation. Yeah.
Apologies to my breakout room for that. Mid leaving that sentence halfway through. I'm trying to include it in the summary.
We were all in that
Same here.
Yeah.
Alan, it's Emma Ross and Caroline O'Neill in Liverpool who were the contacts. I was just typing in the chat bar and it went up.
Fab. Hopefully we have all, by the wonders of technology, returned rather abruptly for this main session. And we are just going to take a minute now just to hear. We've got just over 10 minutes left. So we're just going to take kind of 2 minutes per breakout room, and I'm going to ask each of the facilitators just to feed back, and if they can do that from the perspective of kind of any ideas and suggestions that were discussed, that would be really helpful. But I appreciate you haven't had a lot of time to organise that thinking, so not to worry if that feels difficult. Just a summary of what you discussed would be really helpful. So very unfairly, I'm not going to start because I'm going to try and think through my notes very quickly before I do so. So I'm looking Fab. I was going to say I'm looking to see who looks the most ready. Steph, if you could go, that would be great.
Yeah, and that's fine with me. We had a lovely discussion and lots of interaction. So we had a reflection on some of the challenges, particularly in our group, around engaging families with parents who've got children with behaviours that challenge. As sometimes we're trying to offer something that is already designed in a group format, and maybe we expect parents to fit in to our service offer and our provision that is quite prescriptive. So Hayley at Blackpool and Blackburn with Darwin described this in detail really, and gave a really good example of how they now go and meet the families where they're at and find out what their needs are that they're presenting, and they're able now, with some training that they've had through the Reducing Parental Conflict funding, to offer some bespoke one-to-one sessions with those parents, and that then helps to build on the relationship, offer something at bespoke to them, acknowledge their needs are different, and then can then open up that conversation into other services around the relationship as and when needed on the journey. So that was a really good example. And then we had Alan, who gave a good example around the language and barriers that were discussed around the language to engage families, and some leaflets and resources that he's quite happy to share around connecting with families and using specific language that acknowledges and recognises those families and the struggles that they have that are particularly normal, and all of those families may struggle with those additional needs and circumstances, and the feedback that they had was that really helped to engage them and helped acknowledge how different some of their struggles are, because we've had this for a long time, that you know, the recognition and the acknowledgement is needed that their needs are different. And so that is the first step, I think, to overcoming that barrier and using that appropriate language. And giving the information as soon as possible and as early as possible was another tip, because sometimes it can be a case where families end up in court, as Kathy was saying from CAFCAS, where parents do not recognise that any of the conflict that they're experiencing can have an impact and is having an impact on the displayed behaviours of their children. So we talked about linking up in their areas with the local programmes that have been delivered for the last few years, sharing that information, sharing that awareness, sharing that resource, so that there's a good flow of information across services and for families universally as early as possible. That's it, I think, from me.
Thank you, Steph. That was amazing breadth of discussion that you had in your group, and incredibly well summarised. So thank you very much. Simran, could I come to you next?
Of course. So we had many insightful points that were highlighted about how to increase engagement, particularly as it pertains to language. So one of the first points was that it's quite important to reframe children's behavior as a communication need, and to sort of always adopt this non-judgmental approach by never sort of framing things as a fault in a parenting approach, but just that a child might have a different need, or just language that sort of fits neurodiversity. The second point was related to avoiding professional terminology. So how important it is to rephrase, to to ensure that the language we use is understandable by families. And it was suggested that sometimes using infographics to explain jargon and especially support services that might be offered is very important. So an example was given by Sapna that sometimes we use clinical language to describe services. So we might say that the child might be in need of a speech language therapist, but then parents might think this is a clinical therapist and not find that the support services are actually meeting their child's needs. So using infographics and breaking down any professional terminology or clinical language is really important in those contexts. And then also taking the time to hear the family context was highlighted as very important, utilizing what we called compassionate curiosity to allow for time to understand families' experiences. So what are the strengths of the way things currently are in the family, and trying to just have an open conversation with parents about maybe even their additional needs that they might have and how they're starting to process that. And that might also include just having a check-in at the end of the appointment where they're given time to digest all the information that they've received. That was identified as particularly important in terms of when we're communicating with families. Sometimes it can be difficult to give them that sort of time to process, but even we can emphasize that or accomplish that rather by using certain mediums of communicating. So it was highlighted that sometimes telephone calls don't facilitate conversations where parents can have that time to process the information they've been given, but also to be confident in their responses. But it's more important to just sort of match families' mediums of communicating and use what they're most comfortable with. Yeah, I think that really summarizes some of the things we've discussed.
Thank you, Simran. That was really helpful. Karen, I'm going to come to you, and just if you could, I know you had a slightly different topic, so if you could just remind everyone.
Yes, so our topic was focused on looking at how this evidence could be used in terms of thinking about strategy decisions and also the type of data that might be captured to help inform that. We had a really good discussion. Doesn't time fly? It feels like we could have gone on for quite a while. But I think generally amongst the group, it's safe to say that there was a general consensus that it's really not considered as much as it could be, that there's certainly a number of missed opportunities to use it more within thinking about strategy development within local authorities. Specifically, we talked about the diagnostic process that Virginia mentioned, and actually applying the knowledge about the prevalence of some of these risk factors to help inform the type of support that should be and could be provided to families who are going through that diagnostic process, because that can be quite a long period of time, but also perhaps those that come out the other end, for want of a better expression, either with a diagnosis, but also those that haven't. I think Kate from Trafford made a really good point. The needs of the families haven't changed just because they've been given this diagnosis, and it would be really helpful to think about kind of the pressures and the on parental relationships for those families that are going through that process. Another opportunity that was missed, I think Vicky, I think you were from Northumberland Council. I always get Northumbria and Northumberland mixed up, so very apologies. But she made a really good point, which was about when families are referred to join parental relationship courses, actually why it would be really helpful to have whether they have children with SEND as indicated on those forms, and that would be quite an effective way of capturing that information, which could be used for a number of different purposes. And then finally, I think it was Nadia from Hertfordshire who made the very valid point, which I think everybody could relate to, which it was often the challenge, certainly in terms of commissioning services and thinking about these additional risk factors or outcomes, is the fact that the databases and data systems just don't join up. So trying to pull that information from different, where they might sit in different areas, was quite hard to do, often yeah, not really a straightforward process. So I think those are the kind of the headlines from our session.
Thank you, Karen. That was really helpful. I'm aware we have 3 minutes left. In the interests of finishing on time, I think we've heard a good selection from the breakout rooms, and what we will do is make sure that we include a summary of the discussions in each room when we follow up from the webinar, but I don't want to keep anyone past 11 o'clock, so I will pause us there and just sort of move us on. Just to say, I don't know, we've not got the slides up, but within the slides, there are some resources that we hope are helpful. So the guide that we've sort of framed the community of practice around today is linked, and we will share that. And also a more recent resource on language and talking with families about parental relationships. And I know that came up a lot, even in our sort of plan breakout room. We still kind of discussed a lot about engagement and the language that we're using, and I think that just shows kind of what a key and important area that is. So hopefully that guide is helpful for you locally as well. And just to say, we've got a few events kind of coming up over the next month or so. So starting to think about the planning tool. I know also there was some new coordinators, RPC coordinators in my breakout room, and it's great to have you with us. And so we are hoping to support you guys a little bit more with some induction sessions as well, which you'll see more information about, and hopefully we'll see you there. But just finally, to close with a huge thank you. I hope you found the session useful today. I hope the discussions were helpful, and we will send a feedback survey. We'd really value your feedback to help us sort of develop these sessions in the future. But just a huge thank you for coming along today, and I hope you have a good rest of your day as well. Thank you, everyone.
Thank you.
Thanks, bye.
Thank you. Bye.
Thank you.
Bye. So in my breakout room, we were focused on the plan section. So thinking about how we might use the evidence to inform our local planning and strategy. So we spent a little bit of time initially thinking about what that might mean locally. So what we might use the evidence for in terms of that planning. We talked about the use of needs assessments, understanding the needs of families and how we might inform a SEND needs assessment or broader JSNAs. We thought about how that information might be used in terms of understanding to what extent current support is addressing the needs of families, and we also thought about sort of workforce planning in terms of how we might need to use the information we've got to identify, for example, training needs or different needs of practitioners who are supporting those families. We then came on to a more specific discussion around a piece of the evidence and how we might understand kind of the strategic questions and questions to inform data collection. And actually we focused quite a lot initially on really understanding the experience of families during the diagnostic process and how important that was due to the likely increased stress for families and what we know about that time and how that has an impact on parents and children. And I suppose we talked about that in relation to that being a key time in terms of we would have access to quite a lot of information in terms of who those families are, and therefore when we're thinking strategically and planning about how we might support families, we'd have a good idea of how we could maybe target that support. But also in that being a really key and stressful time for families, and therefore thinking about sort of that being a really important area of focus locally from a strategic perspective. We also talked about the importance of local context and being aware of that when we're thinking about planning and strategy.
understanding the context that we're all working with in terms of kind of finances, the difficulties in sort of some of the conversations around support, providing support for this group of families, and thinking about sort of the importance, I suppose, of asking these key questions, but then thinking about what we're going to be able to do with the information, and that being a kind of key question that informs kind of what we are looking to collect in order that we are able to improve the experience for families with that information. We then had a bit of a discussion about how well this is understood locally, and by that I mean in terms of children with special educational needs and disabilities, and the impact of parental conflict, and also the risk factor for those parents. And we talked about kind of whether we thought that was well understood within that workforce within local areas. And I think there were sort of differences in terms of whether that felt like quite an opportunity locally, or something that had been tried in terms of training and the discussions that we're having. And I think that's across, so sort of from practitioner level up to sort of strategic lead level, and different conversations that we perhaps need to be having with those different colleagues. But that led us into a bit of a discussion actually about the language that we're using, about the language of parental conflict, and whether that's helpful. Zoe made a really important point about that language might be correct professionally, but that actually when we're speaking to families, we would use very different language, and we would need to support practitioners with that, and also the importance of some of the more recent resources in terms of the language guide in supporting some of those conversations, but also training for those practitioners who are working with families around SEND, and how we can support that. So we did move into that sort of language conversation, as well as having a bit of discussion about what we know in terms of the data locally, and then kind of what's known from a strategic perspective.
All right, so we had a lot of really interesting discussions in our group around how we can engage parents of children with behaviour challenge in our services, and how we support them to stay engaged with those services. So regarding recruitment into services, we discussed how some terminology might feel stigmatising for parents, such as the term parental conflict, and how using the term healthy relationships can be more helpful, can be more appropriate as well. We discussed how this is especially pertinent amongst parents with children who have SEND, as they may already be feeling stigmatised, marginalised, or blamed for the additional parental stress that they may be experiencing and the resulting parental conflict. We also discussed how fathers might need to approach support differently. So often services have been set up for women and mothers as the primary caregiver, which means that fathers often so they often feel excluded from the process from the start. And this creates additional barriers for fathers of children with SEND, as they may be in a different place to when it comes to understanding SEND, such as understanding different terms and what they mean. And one participant explained that this is something that their family support workers are often noticing in their services. So we talked about how we can then make services more inclusive. This could be kind of visually in flyers, but also avoiding using kind of professional jargon and acronyms as well. We talked about how we can avoid using ableist language and reflect the language that families are using to describe their needs. One participant raised the importance of including the child's voice throughout the process. So this includes from the point of referral, throughout the intervention, and when completing the monitoring and evaluation as well. So we also discussed the importance of peer support in this process, and how that can really help to retain families and services as well. And we discussed different ways to kind of bring families together, as well as wider family members and caregivers, to be able to share their experiences and just feel less isolated and alone. And this kind of fed into a wider conversation around normalising parents' feelings of maybe being upset or frustration, around their experience of parental conflict, and how we can really make room for parents to safely express these feelings and be able to really focus on their relationship with the other parent, where they might previously have bottled up the feelings due to their caregiving abilities. And that was about it.
The discussion in our breakout room was very interesting, very similar to other discussions actually. We focused on challenges experienced by local areas and also some strategies that can be used to engage parents of children with behaviours that challenge. In terms of challenges, we focus on two main aspects. Parents might have some of the needs that are also experienced by their children. So how to support these parents, especially if needs are not diagnosed. So they might need some time to actually recognize they have the same needs experienced by their children. And also the fact that there might be delays in referrals, which means that families might access support while they have some very serious issues in terms of parental conflict. They might already be in crisis. So how to support families if this happens. In terms of strategies that can help to engage parents, we had a very useful discussion about 4 different strategies that can be used. The first one is in terms of the terminology used and the language used when communicating with parents, how to use actually the same language that is used by the family to make sure that they can understand the content of the discussion, and how to avoid jargon. In terms of support, it was important. It was something that was discussed at different point. There might be families may need some support in terms of understanding the diagnosis of the child. So of course there might be delays with the diagnosis, but it's also very important to make sure that families can get support if they need help to understand the diagnosis and what it means. There was also an important consideration about providing support and acknowledging that support can involve different professionals, and making sure that the process is very clear in terms of the support provided, and that this can help to manage expectations. And there was also an important consideration about inviting other professionals to the sessions to signpost people to different information and to provide all the information needed by parents. And finally, a very important point that was discussed was peer support, and how this can be helpful not only to discuss children's needs and how to provide support to children, but also to talk about the interparental relationship with other parents experiencing similar situations.